Hey guys, my paper is over psoriasis with an emphasis on psoriatic arthritis. So a lot of people know of psoriasis as, just dry, itchy skin, but there's a little more to that, and we're going to go into that today. Um, so the cause of this disorder is unknown, but it is said to be an autoimmune disorder, which means, well, for this specifically, the T cells and the it's an autoimmune disorder caused by a response from the T cells and the neutrophils. So basically, the T cells, which are what fights off the infection in the body that is caused by like a virus or a bacteria, during a psoriatic outbreak, the T cells are actually attacking the person's healthy skin. Um, so when the T cells are attacking that skin and destroying the skin cells, it causes an increase of healthy skin cells. So what that does is that's how it presents as the patchy, dry, flaky skin, because you have an increase of the cells at that area. While the cause is unknown, there are multiple triggers for the condition. These triggers could be some infections like strep throat, a skin infection, stress, smoking, alcohol, and even a vitamin D deficiency. Some of the signs of symptoms, of course, are the red, flaky skin, the dry patches of the skin, which may actually bleed. And these spots can be small or patchy, just, random different spots on the body, but it could also cover the body in its entirety, which is a pretty gruesome outbreak. And as for the psoriatic arthritis, which is, you don't necessarily have to have one without the other. I think that you do. I think it's more common to have the psoriasis and not necessarily have the psoriatic arthritis. But with the psoriatic arthritis, it presents a lot like rheumatoid arthritis would. So it affects the smaller joints first. There's inflammation and a lot of pain for the patients. The joints will be inflamed, swollen, and it's pretty painful, but it's not typically as debilitating as your typical arthritis. But if you don't treat it and it allows to progress, it can cause some major damage and deform the joints, which would then decrease function for the person. So there's many different treatments for psoriasis. It starts, usually when they're diagnosed, they'll start with topical treatments, which would contain corticosteroids, vitamin D, and retinoids. And then there are also different types of light therapy that can be used. Interestingly enough, my niece who has arthritis or psoriatic arthritis was suggested a tanning bed. So they use some UV lights, sunlight therapy, just hanging out in the sun, getting that vitamin D. And so what this does, it will help reduce the overproduction of skin cells. There's also something called Psoralen Plus Ultraviolet A, and it's a more aggressive form of light therapy that they can do to help with the actual treatment of the skin. And then for the most severe cases, there are oral medications and injectables. And some of the injectables are what also will help with the psoriatic arthritis. So some of those medicines would include methotrexate, cyclosporine, and biologics. However, those medicines can affect the body's immune system. So you have to be careful when you're taking them and make sure you stay up on your doctor's visits. So as far as physical therapy treatment goes, it is suggested that they do, for the psoriatic arthritis, engage in exercise and physical therapy to manage the symptoms of the psoriatic arthritis. So it's lower impact exercise is preferred over higher impact exercise. However, unless contraindicated, those who prefer more high impact, those who can, they can continue to do that. Just when they're inflamed, they need to bring it down a little bit. Physical therapy is a very important when it comes to managing psoriatic arthritis, and these and the interventions can include maintaining range of motion, strengthening, and cardiovascular health. Also, physical therapists can use different modalities for treatment of psoriatic arthritis, such as cryotherapy, which can help reduce pain and swelling in the affected joints, paraffin baths, splinting, and splinting is also used for the hands and feet if they become deformed. So just a little bit on my experience. I have a 15-year-old niece who has psoriasis. It started actually with strep throat. She got strep throat, and then shortly after that, she broke out all over her body, and they didn't know what it was. It took a while for them to treat her, to figure out exactly what it was, because it presented in a different way. But once she got that diagnosis, they started with the typical creams and topical treatments to help that. And then most recently, she's now 15. She had one of the worst outbreaks I've ever seen of psoriasis. It covered her entire body and left it to where she is now on injectables, biologics. She's been on 2 different ones. One of the biologics is called Stelara. And now she is taking, and she's done methotrexate, which really can suppress your immune system. So what it does so what I witnessed for the impact on the patient and how it affected them, I mean, can you imagine being a teenager and having, and being in high school and having your body covered in these things, these spots. So, and the pain of the psoriatic arthritis while she's trying to play sports. But it's a disease that is manageable, and sometimes your body will get used to the different medications and the treatments, so that you have to change them up, and you just have to maintain your doctor's appointments. So that's all I've got for you. I hope everyone's doing great, and I'll see you eventually. Bye.